So one of the most common things that we hear in our profession is how we're facing a large obesity epidemic. I think a lot of times we don't really think about what that means. I think we don't really fully grasp the numbers and the magnitude of it and how it affects all of the downstream health in our country, in the world, and the clients that we work with. Marissa, why don't you kind of tell us a little bit about, one, how do we clinically define obesity and overweight?
Yeah. So in practice, we define overweight as a BMI or body mass index of 25 to 29.9. And any BMI that's greater than 30 would be considered obese. And obesity is then further classified into 3 classes. So you have from 30 to 34.9 is technically class 1 obesity. 35 to 39.9 is class 2. And then class 3 is a BMI greater than 40. This is something we typically recommend to look at and you talk to with your doctor or your healthcare professional so they can help determine what your BMI means and whether or not that makes you a candidate for weight loss medication.
So I think there's also a lot of kind of maybe misunderstanding about BMI as a tool and how we use it in clinical practice, whether you use it with patients or we use it with clients. People assume we use it as this crude tool to diagnose people. When we actually work with clients, can you maybe give us a little more insight into how we actually use BMI as a way to classify? And is it the only thing we use, or is it just part of the entire person that we work with?
Yeah, so we use it to help classify obesity for weight loss medication because there are restrictions. You have to meet a certain BMI to start GLP-1 medication therapy. So normally you have to have a BMI of 27, so that's overweight, plus another comorbid condition, so something like hypertension or diabetes, and this is very common for this type of individual, or a BMI greater than 30, which is obesity. So typically that's what you need to meet to have like the minimum criteria to start a GLP-1 medication.
Yeah, and I think it's also important to realize too that the BMI is used, across the world, right, with different healthcare systems. And so epidemiologists, healthcare professionals will use it to help document and also track, right, the correlations between BMI and chronic disease. So I think that that's important for the fitness and the wellness professional to realize is that, a lot of times when BMI is used, it's used by the healthcare professional, obviously for the individual, but it's also used for a greater understanding, right? And so that's something that I think we need to also consider when we look at obesity rates across the world.
And it's not just a diagnostic criteria, it is a risk factor for all these other comorbidities. Correct. So when we think about it, it's really not just a single use case. It also tells us how high is the risk for a patient of developing diabetes, cardiovascular disease, even some forms of cancer. So Scott, maybe tell us a little bit about what is the scope of this problem of obesity and overweight, both in the United States and worldwide?
A great question. So the World Health Organization in 2022 published their most recent statistics suggesting and estimating that 2.5 billion people worldwide are suffering with overweight and obesity. 890 million of those have a BMI greater than 30. And so that has really gave support to the GLP-1 GIP agonist medication that we've talked about. But also though too, I think it's important for the fitness and wellness professional to realize that we have another category that's growing, and that's with children and adolescents. We're talking anywhere between 5 to 14 years of age. Some data coming through is suggesting that we're seeing almost a 20% spike coming from US statistics and even statistics around the world. So we're seeing that they're hitting that 85 or 95 percentile of weight at a younger age. So again, a lot of world healthcare experts, CDC around the world, we're looking at this obesity epidemic occurring possibly in younger ages, but we're seeing it a lot in our older too. We're seeing this continuum.
And when we talk about obesity and the effect that it has on overall health, we know that it is sort of the initial start of a lot of metabolic diseases, things like diabetes, cardiovascular disease. Maybe Marissa, you can give us some insights into exactly what is the risk, how does obesity impact some of these conditions, and then how do we think about these current medications and how those reduce some of those risks?
Yeah. So obesity can definitely play a role on these other conditions. It can worsen them. It can make them more complex. It can enhance, the amount of medications that people are on, or different types of dietary modifications may need to be had to address both the obesity plus the other condition. So it really increases your risk for these really dangerous, potentially conditions that you could get, as well as increasing your risk for death, things like that. So you really want to be able to address the root cause, but it may not be as simple as just diet and exercise. So it's really like a whole health type of intervention that needs to be had.
So when we talk about the kind of way to address and treat obesity, Scott, when we think about the fitness professional and then we layer on some of the new weight loss medications, how do those two work hand in hand? And then how do we as fitness professionals think about that in the work that we do in trying to either prevent or help people address obesity?
Yeah, I think, as we mentioned, before, and a lot of the success is grounded in the lifestyle modification that has been discussed and will be discussed throughout, this series. And so I think the combination of, good diet, good dietary habits, regular exercise, behavior modification, that's going to be the core. And that has been demonstrated in all the clinical trials of all the new GLP-1 GIP medications, is they've all been grounded in those good behavior patterns that are built around that healthy lifestyle modification. So I think for the fitness and wellness professional, they can definitely promote those good habits. They can coach the client within their scope of practice, and then they can definitely partner with registered dietitian for dietary modifications. So I think the center of a lot of the management is going to be centered around the fitness and wellness professional, since they're going to be working with their clients on a weekly basis. So they got to promote all the good stuff.
And so as we see numbers like 2.5 billion people around the world, and we see a lot of these rates increasing as countries develop and become more urbanized and modern, and work shifts from physical work to service work, how do these medications and the physical activity and lifestyle, how does that help combat a lot of the just lifestyles that we live now of having very sedentary jobs? We have very energy dense foods. We can have food delivered to our house. How do these medications and the lifestyle pieces, how does it combat some of those things that are kind of the environmental factors that are driving us to having an energy balance and obesity problem? And how do we think about that?
I think the medication definitely helps. GLP-1 specifically, they help with a dietary modification and behavior towards foods. So people might see their typical routine that, like, if they have a work from home job, maybe they're going to change their diet to match some of their goals that they have for weight loss. So maybe instead of keeping snacks at the house, they're going to keep whole foods like fruits and vegetables and things like that, because that's what the medication is meant to do. It's meant to help the patient or the client to modify their diet and really transform and create that lifestyle, that healthy lifestyle is what they're really trying to do. So the medication can definitely help with that.
Yeah, and just to add too, as we are tackling this obesity epidemic, and we understand that the medications are very good to work on, appetite suppression, slowing the gastric emptying, that may give them some low food drive periods where they could take advantage of that. But also too, we also have to acknowledge too that, as these medications get dispersed around the world, there is some disadvantaged countries, disadvantaged communities and stuff like that. So that's where I think that the education component, as we scaffold out, from, kind of the hub, is going to be important to be able to educate people and be able to help them, have that self-efficacy and those good behaviors while complementing the medication. So I think it's a process that we'll be going through over time. But it's, as we've seen the last 10 years of research, the GLP-1s are great so far. So there's some excitement with that when it comes to the future.
So to kind of wrap this section up, I think we've talked about the fact that obesity it's a global problem. It's not just a U.S. problem. It's a growing problem. It has a lot of downstream health consequences. A lot of the modern chronic diseases and leading causes of death we see are associated with obesity, and even obesity has some causative factors in those. And between lifestyle modification, which is diet, exercise, behavioral counseling, and then even, changing your social environment and your support structure, along with these new classes of weight loss medication. And as those lower body weight, we actually do see a lot of downstream health benefits.